Broke my foot. That's my busted knee, busted elbow, broken scapula. Oh, that one really hurt. So unfortunately, all those x-rays are in fact mine. My name is Darius Moezzi. I'm an orthopedic surgeon. I've been practicing in Flagstaff for the past 11 years. Flagstaff's a wonderful community for the outdoor enthusiast. And certainly, as you can see, some of my passion centers around cycling, both road biking as well as mountain biking. So my specialty at Flagstaff Bone and Joint is knee and shoulder surgery. My philosophy is to get patients back to their pre-injury state as quickly as possible. Even though I did a fellowship in sports medicine, much of what we deal with in knee and shoulder surgery isn't simply with athletes, but also problems that you can see in older individuals as well. Really, one of my passions is centered around shoulder replacement, surgery. This here is a model of a reverse shoulder arthroplasty. We call it a reverse because the ball and socket are actually switched from what normally occurs in the human body, where the ball is actually on the top of the arm bone or the humerus. This functions biomechanically in a very different manner than our normal shoulder. And the beauty of this implant is you can now treat arthritis in patients that don't have a rotator cuff that's functioning. You can also use it in older individuals where this upper part of the bone may have been damaged from a previous fracture, or they may have had a prior shoulder replacement done in a traditional sense that has failed. And so this is a great replacement for an older individual if you're doing a revision or a redo surgery. One of the common problems we see in young athletes is shoulder dislocations. That occurs where the shoulder actually comes out of the socket. Can happen not just in sports such as snowboarding or basketball, can occur even actually falling off a ladder. That surgery has a very good success rate when we treat that arthroscopically. Similar to that, a very common injury we see in the shoulder is a tear of the rotator cuff. The ball is surrounded by a series of tendons. I talked about the function of the rotator cuff in the setting of arthritis, and when you don't have that rotator cuff, you need to go to a reverse replacement in the setting of arthritis. So we've talked about my interest in shoulder disorders, shoulder replacement, rotator cuff tears, etc. The other part of my practice is actually centered around the knee. Just a couple descriptions of some of the more common problems we see in the knee. This is a knee replacement. Here's the femur. This is the tibia or the shin bone. And like other joint replacements within the body, whether it's shoulder or hip, you're essentially resurfacing the ends of the bone with metal with a little plastic insert in between. The other component of knee problems and disorders we see include sports injuries such as tearing the ACL or anterior cruciate ligament. The ACL is this ligament right here in the middle of the knee. That ligament prevents the tibia or the lower bone from being pulled forward. And that can occur usually traumatically after playing football, soccer, snow skiing, a very common injury. And we've actually seen many more of these injuries in young females since soccer has become much more popular. Why did I get into orthopedic surgery? Well, it actually stems from, like many of my colleagues, an injury that I had in high school back my junior year playing football. And I was very impressionable at that point in my life and was treated by one of the U.S. ski team physicians in Lake Tahoe, near where I grew up. And from that point forward in 1986, that's when I decided that I wanted to become an orthopedic surgeon. I was born and raised outside of Reno in a small town called Lovelock, Nevada. I did my undergraduate work at the University of Arizona in Tucson, went back to Nevada for medical school at the University of Nevada. I was fortunate enough to be selected into an orthopedic residency, and this was performed at Tufts University in Boston. After Boston, I decided to subspecialize in sports medicine and knee and shoulder surgery, and did that at University of California, San Diego. And since I completed my fellowship, I've been here in Flagstaff for the past 11 years. Since 2006, I've had the privilege of being one of the U.S. ski team physicians. This has been an absolutely wonderful experience, being able to travel all over the world and work with many of our finest U.S. ski team members. Well, that about does it. There's more about me on my bio page at the FBJ website. Ooh, oh man, that's gotta hurt. Well, remember, be careful out there and always wear your helmet.